Hello, fam. My name is Lady Dr. Price, and welcome back to my channel where we learn how to live well and lead by example. So, today we are discussing, I normally do the book reviews, but today I'm going to be doing a scientific paper review basically. So, this paper is on lifestyle medicine. It's from the Journal of Climate Change and Health back from 2021. The reason why I'm doing this is kind of to give different people a perspective, especially people who aren't exposed to scientific journals, people who aren't very exposed to science writing as a whole. Not only that, but it could be just, a good summary for someone who's in the medical field who, maybe hasn't heard of these specific topics that I read on, and might be able to help them in their own practice or at least inspire them to go and read it themselves. I will also link the article down below in the description box so that you can check it out yourself and, maybe go further and look at other possible resources on this topic. But so basically, I really like this paper because it was very holistic. And as you know, if you've been following along on, my different social media platforms or here on YouTube, I do like to take a very holistic approach to wellness and lifestyle. I think it's important that we not only look at, your physical health, because a lot of people think, holistic wellness and we only talk about the physical portion most of the time and some of the mental as well, mental health awareness, getting therapy, things like that. But we talk a lot on diet and exercise, which is very important, but there's so many different aspects to health, right? So it's not just your physical health and mental health, it's your spiritual well-being, it's your social health, how you stay connected to others. It is included in your sleep health, environmental health, financial health. There's many different layers and aspects to health that all contribute to the body, which is you. So I do like that paper from this aspect. They don't necessarily address the financial health aspect of it, but they address a lot of different areas. So the title of this paper is Lifestyle Medicine Prescriptions for Personal and Planetary Health. So just to kind of give like an overall summation, they're talking about what we can do as doctors specifically to advocate for better outcomes in environmental health. Because the thing is, right, like I had mentioned in a prior video, is, if your environment is sick, 9 times out of 10, you're going to be sick as well, right? Like if it's cold outside and you go outside, you're going to get cold. But yeah, so I do like that they are basically imploring doctors and healthcare providers to be more involved in environmental health and climate change and taking that perspective into account when you're addressing your patients and their various needs as well. The first thing they go through, right, is addressing the effect of climate change on health. And they talk about how, I think they said, let me see. Yeah, 60% of adults in the United States alone have at least one chronic illness or condition. How many people do we know that's not on medication? So yeah, that's a concern. And it's not likely to decrease unless we make an intentional intervention. So I like here that they also discuss the increased risk of nutrient loss from crops because, as I had discussed before, even in like Dr. Bobby Price's book, I like that he had addressed that, how we have more nutrient depletion in our foods because of unsustainable farming practices that we have specifically in this country, but I know that this isn't the only country that has unsustainable farming practices. It's an issue because, I know we're always trying to address the issue of getting more food to more people, but a lot of times we have more food, but it's still not getting to those people for various reasons, socioeconomic reasons, various reasons, that there are barriers to getting people food. And a lot of times we just think, oh, we just need more food, more food, more food. And in doing that, we aren't considering how we're affecting the food system. I mean, because if you are focused so much on quantity and not on the quality of the food itself, then you're creating a whole plethora of other issues. They had discussed that it says here the increased risk of nutrient loss from crops added to a global nutrition transition to a more energy dense processed diet, the inability to safely perform physical activities outdoors, which they also address that because of the not only climate change but also like air pollution. There are so many people that live in cities, in urban centers, and just think about, like, I mean, you can't healthfully, safely even like exercise outdoors. I mean, especially like think about somebody, which a lot of people have asthma, and not even just the people who have asthma, but think about them trying to go out in the smog and exercise. And a lot of times we advocate for our patients to go do that, you know, get outdoors, get that oxygen, all that sort of stuff. But in a lot of areas, you're getting more than oxygen when you're going outside. And we do need the sunlight. We do need the air. We need to be in contact with nature. It's very important to our health. But it's something that we need to consider, especially those of us who don't necessarily live in urban centers or in very highly polluted areas. When we're saying this to people, keep that in mind that, you know, with air pollution, with climate change and everything, maybe we need some alternatives for people that is reasonable for them, because not everybody can just drive out to the country to get better air. So, yeah, it's something to definitely take into consideration. Also, with that, it helps us to, as physicians, figure out other areas that we can advocate better for our patients and for healthcare and for health as a whole. Because what I had just talked about, you know, health is more than just your physical health. It's also environmental health. So us as physicians, as healthcare workers, can do more to advocate for either different policies in environmental causes. We can even do things locally. It doesn't have to necessarily be like a whole federal policy, although that's great. Like, I do think if you're in that capacity, you know, as a senator or whatever, please do that. If you're a part of a super PAC or something that is like gaining funding to advocate for these things, please do that. But even locally, like, we can advocate politically for these changes as well. But then also, I mean, just even going out, I haven't done it recently, but I used to do this very regularly, just going out on my own block and picking up garbage on my block, you know, going and doing cleanups or organizing different cleanups for people. I know when I was going to school in Barbados, I was a part of Ross Environmental Initiative. It was a great club. I absolutely loved that. And we were advocating for environmental health. I mean, we would organize beach cleanup and then also organizing like recycling on campus, because that wasn't a thing, you know, before we were there. And even the hospital that I'm at now in Michigan, like, I think I know of 2 recycling bins in the whole hospital, and that's an issue. We don't recycle enough. So, you know, whether you're in healthcare or, you know, whether you're not, like, these are some things that anybody can do. You can go and, you know, clean up your street or organize your neighbors or what have you to clean up your street. You can advocate for recycling in your workplace. It's just something simple that everyone can do. So yeah, another great point. They were also talking about limitations on restorative sleep and disruption to social cohesion and connectedness, which I talked about in the sense, you know, social health is important. You need to go out and connect with people. We are social beings as humans. And there's more of us that are withdrawing in the age of social media. There's too many of us withdrawing and just, staying to ourselves. Now, don't get me wrong, I'm an advocate for solitude because you do need times of solitude, but that needs to be balanced out as well with the social aspect. It doesn't mean that you have to go to huge parties or anything like that all the time, but you need to have healthy social connections. Go to your local gym and join a class, or find other, healthy social environments that you can be in, whether you're learning more about your health because you went to a local class, or I like to even go sometimes to foraging classes or herbal remedy classes. Yeah, there's a bunch of different things. You can go to like an open mic and enjoy the poetry scene, the music, that kind of thing. There's a bunch of different things you can do, but just get out there and be connected to your community. It's important for you, it's important for the health of the community and other people. It's very important. And then also with the sleep hygiene, they were talking about that, and I thought that that was also very interesting because with each of these, including the restorative sleep, they had given like an outline of the issue. So let me show you like an example for physical activity, right? So they give you like the outline of the actual issue, and then they give you like their prescription. So for sleep hygiene, for example, they talk about poor sleep quality being linked to chronic disease, including cardiometabolic disorders, obesity, and inflammation, as well as mental health conditions. Yeah, sleep is important. I know the typical is getting 8 hours of sleep is very important. Even outside of the time frame of how much you should be sleeping, I was just talking to my sister about this. It's important to have healthy sleep hygiene. So, which I can do actually a separate, a little short video on the importance of sleep hygiene. But basically, it's just what is your routine when you go to sleep? There should be a routine that your body is used to have proper sleep. Basically, like habits that tell your body you're safe, it's time to go to bed, you have your environment set for sleeping. Like I've heard of even the tip of making sure that your bedroom is just for sleeping. Now, granted, when I'm saying this, these are great health hygiene tips or sleep hygiene tips, but I am not the best at this. This is something I'm still working on. Keeping your bedroom only for sleep. So you shouldn't be in your room doing workouts necessarily. You shouldn't be in your room doing work on your laptop, on your phone. Honestly, all of those devices should be outside of your room, including like TVs and such like that. All of that stuff should be outside of your room. And there's even like tips on journaling before you go to sleep, making sure you are not using any devices like at least an hour before bedtime, different things like that. But yeah, I think I will do a video on that. I'll write it on my list. So yeah, they were talking about that. And then something else they had pointed out was just like not only just prescribing the 7 to 9 hours of restorative sleep, but also it says to focus on interventions as healthcare providers, as non-healthcare providers. Focus on interventions such as tree planting in urban areas can help reduce heat stress and noise pollution, improving sleep quality, which I didn't even think about, but I remember seeing a poster at one of the conferences, family medicine conferences I've gone to, talking about how having more trees in urban settings are important to cooling the environment, right? Because with climate change and everything, you have like global warming. And then, especially in city centers, you have even more heat in that environment because you don't have the trees there acting, again, even more in their capacity to lower the heat in that environment. So, trees have a lot of different benefits to the environment. You know, they can lower the heat, they can actually decrease noise pollution. And of course, they're there for us to breathe, so they're very important. But I love that that was included. Not trying to like tell you the whole paper because I want you to read it, but it's very interesting information. The other thing that they had went over, because they had broke this down into the 6 pillars of lifestyle medicine, we'll be doing a video on. But one of those pillars are on toxic substances and avoiding toxic substances. But in the toxic substances, a lot of times you hear that and you're thinking alcohol, you know, you're thinking different illicit drugs and things like that. Those are important to stay away from for your own health, yes. But I also like that they pointed out different chemicals in our foods, different chemicals in the air, in the environment. Again, it's like heading back to environmental health and the importance of it for our own health as individuals. They had pointed out, like, what was it? PCBs, for example, like organic pollutants, dioxins, endocrine disruptors, like insecticides. All of these different things are included in the toxic substances, and they gave a little more realistic view of it. It's very hard, especially in this environment and where we are right now, to avoid all toxic substances because it's in everything. So instead of overwhelming yourself with trying to avoid everything, or as healthcare providers trying to get your patients to avoid everything, just giving them different like actionable steps, different ways that they can avoid some toxic substances even in their foods and stuff. Like, you know, saying like, oh, you know, instead of fruit roll-ups, for example, then giving them even like healthier alternatives, whether it's like drying out your own fruit or finding like an equivalent of a fruit roll up that has less ingredients in it. Just giving that as an example, but then also being aware of the fact that not everybody can afford those alternatives. So again, it's like a mindset switch. We, even as healthcare providers, can go and look up different things that are affordable that can replace different things that our patients like, or even outright telling them like, hey, probably shouldn't be drinking that, probably shouldn't be eating that, because a lot of people don't know, you know, a lot of people don't know that some of the things that they shouldn't be eating, because I've heard people even say like, oh, well, this is better than that, and it's like, well, you shouldn't be eating it at all. I also liked learning about the fact that a lot of these chemicals that I had just listed are lipophilic, which means lipo, fat, philic, liking or loving. So lipophilic means that these chemicals like fat. So that means that they're stored in the adipose or fat tissue in our bodies. That's important to know, especially when you're trying to help a patient that needs better weight management, because if you're overweight or obese and have more fat tissue, then that means more of these chemicals are being stored in your body. So, and they give even some recommendations on like how to help your patients lose the weight, but not losing it too fast and the different effects of that. So I think that was actually very interesting and very beneficial. Losing weight actually can help to reduce your stored toxins. In conclusion, it says concurrently, population health is threatened by this deterioration of planetary health. As health professionals, we can bring to bear the science demonstrating that access to healthy plant-based foods, green space, safe active transport, and avoidance of noise, light, air, soil, and water pollution are prescriptions for community health. And I absolutely love that. It's a good summation of like what I'm an advocate for, what I stand for, even with this channel, just, you know, getting people to think about things a little bit differently, having these conversations, and making us aware that health is a gamut of things And we need to not only do better, but inspire each other to do better in these different areas so that, like I said, we can live well and lead by example. So hopefully this was interesting to you. I have done reviews on books before, but yeah, it's a little bit different. But I definitely enjoyed the read and enjoy doing this, and hopefully you found it interesting. Let me know if you check it out. Let me know what you think. Let me know if you have any questions or want to have even a conversation about this topic. I would love to. And I will see you next time, love.